Okay, hi, good morning, everyone. This is Kate Subata with Clean Slate People. And for our second interview, we're very, very pleased to have Richard Elliott with us. Richard is one of the new wave of young politicians who are coming into the field. He has a substantial portfolio, having worked in a number of campaigns. He has a master's degree in public issues and say it again.
In political science.
Political science. He's worked with legislation drafting, all different other kinds of things. And he is running for the state position. Richard, could you give the exact district and information?
Sure, I'll do a short introduction. Hi, I'm Richard Elliott. I'm a candidate for the House of Delegates in the 24th Legislative District, located in Prince George's County, Maryland. Stretches from about the edge of Bowie and Greenbelt along MLK Highway, all the way down to Suitland through Glenarden, Capitol Heights, and Seat Pleasant. I am one of several candidates, with there being 2 open seats. And I plan during this conversation to talk about what I plan to do to address COVID and other pandemics heading forward, along with any other questions that Ms. Kate has to ask me. Thank you for having me.
Thank you, Richard. So Richard, tell us about what you feel needs to happen on the state level for the recovery from the pandemic and for us to go forward as a state.
Sure. So some of the things that I support for us to do moving forward to address primarily economic things during the pandemic. The pandemic has seen not just a large amount of death and destruction in terms of health, but also huge amounts of wealth theft by billionaires, oligarchs, individuals like Jeff Bezos, who've gotten significantly richer. We need to, one, increase the minimum wage, I believe, to at least $25 an hour for larger businesses, and for businesses such as Amazon, Walmart, that make billions on billions of dollars. That minimum wage needs to have even more flexibility to go higher. I strongly support the legislation in the State House to add paid family leave. That is something else that has come about during the pandemic. Now more than ever, we need universal health care coverage. So the candidate I'm supporting for governor, Peter Franchot, he supports expanding Medicaid. That is not universal coverage. I'm not going to pretend it is. But when we get to universal coverage, every dollar that we save by partnering with the federal government, partnering with other states, is another dollar that we can spend as Marylanders on healthcare clinics, on nurse pay supplements, on other things that improve healthcare quality. So those are 3 of the main things I want to push for: a significantly higher minimum wage, universal healthcare, and healthcare expansion. I also want to help for a state stimulus. Comptroller and I talked about the stimulus when it first went through. It was unfortunately only for folks that qualify for the earned income tax credit, which in Maryland is a very small amount of money. I think it's about $14,000, $15,000 a year. Almost nobody that is a single adult can afford to live on that just because of rent and costs. If we do another state stimulus of $2,000 in payment that can be distributed either via check or through a debit card that can function as a bank account thereafter, that can, in the moment, sometimes you need long-term solutions, but in the moment, you need stuff that helps people today. There are plenty of Marylanders behind on rent. There are plenty of Marylanders that can't afford the food and stuff they need. There are plenty of Marylanders who have gone into debt in order to fund the necessities. That $2,000 right here, right now, shot in the arm, will do considerable on helping Marylanders today. So those are just the economic aspects. Let's also go into health. There have been the Prince George's Hospital has opened during the pandemic. I spoke with SEIU 1199 regarding their staffing issues, regarding their service issues. We need to recruit, retain, and better improve the standard of pay and benefits for nurses in our state. Maryland is ranked dead last, and was ranked dead last before the pandemic, in what we offer to nurses. Nurses in our state deserve to have their student loan payments covered. You should, once you've been a nurse for 2 years, no student loans. Nurses deserve higher pay, in particular as a percentage of the pay that a hospital provider gets, whether it be an insurance entity, a nonprofit, or an individual that runs the hospital. You've seen hospital CEOs make millions and millions and millions, while nurses have been on the battleground and have not seen pay increases and other benefits. If we want to fight pandemics, you got to give the people who are administering the cures and taking care of people the best care. And then finally, on regards to representation, there's been legislation by Delegate Jocelyn Pena-Melnick, who is up to bat to be the chair of the Health Committee in the House, who wants to help to diversify and get more Black and Brown service providers in mental health care and in nursing. I strongly believe in that. And again, if we do that, if we follow the comptroller's plan when he's governor to erase student loans, we will bring so many talented young folks of all races into this state who can help us chart a path forward so that folks like you and folks like my grandparents have a tax base, along with have people to serve you in various administrative capacities in our state to make sure you get the services you need and improve services where we've seen service either stagnate or get worse. So those are just some of the things I want to do. I've put into the chat, and I can, once this video is shared, share a couple of articles about things I said needed to be done before the pandemic. But like she said, that stuff has already happened. All we can do is chart our path forward so that when the next pandemic happens or when the next surge comes, we are prepared, because now through failure, we have no excuse in failing again. I must say, we have no excuse in failing, as we did, not just with COVID, but in each successive surge. It wasn't just once. In each successive surge, we as a state, we as a country have failed. I want to help chart that game plan once I'm in Annapolis, which will be next year.